Welcome to the Hormone Optimizing Warrior MD, your reliable and trusted source for information on hormone therapy for menopause and beyond, and on how to advance into the second half of your life with confidence and optimism, knowing your hormones are optimized and balanced with everything else in your body. Whether it is hormone therapy, peptide therapy, laser therapy, or some other new technology applicable to maintaining our vitality, mental and physical strength, you will hear all about it in this podcast. Today's podcast topic is something I promised a long time ago, and I have touched upon bone strength in a variety of podcast episodes, but I haven't really dedicated a specific podcast on osteoporosis. And this is what we're going to do. It is the time. Our bones matter. We do take them for granted until, unfortunately, they break. So let's talk bone strength and osteoporosis. Well, what is osteoporosis? I'm not going to bore you with medical definitions. It is very simple. We really don't need complicated definitions to explain it. It is a weakening of the bone structure, which increases the risk of a bone fracture. What causes osteoporosis? What do the statistics show? Who is most at risk for osteoporosis? How do we diagnose osteoporosis? Are there any specific medical indications that predispose men and women to osteoporosis? How do we screen for osteoporosis? How do we test for it? How often do we test? Who's the best candidate to be screened for osteoporosis? When do we start screening? What is the best treatment for osteoporosis? What are the best natural interventions to keep your bones strong and maybe avoid osteoporosis entirely? What is the best exercise to treat osteoporosis and to prevent osteoporosis? Can hormone therapy help osteoporosis? What does estrogen do for bones versus testosterone? What about both of them? And last but not least, how safe are the modern drugs offered today for osteoporosis, which have unfortunately become the standard of care, like Fosamax, Boniva, Prolia, Evenity, and much more. Now, these are a lot of questions to answer and to consider when we approach the topic of osteoporosis. Today's episode will start with the beginning. So I'm going to explain osteoporosis and who is most likely to be at risk, and start here and see where this is going to take us and how long it's going to be. Because in order to correct and fix something, you need to understand how it is happening. Now, what's clear is that majority of men and women take the strength of their bones for granted. Now, ask yourself, are you one of those men or women? Are you taking your bones for granted? Do you think about your bone strength at all? Do you even take it into consideration in your daily life? Now, are you someone who has never tested for osteoporosis, like myself, and you have no idea whether or not you have it? I'll tell you why I haven't tested myself, because I have no family history and my mom has really great, strong bones. Now, are you personally afraid of osteoporosis? Maybe because of family history. Do you have family members like one of your parents who suffered osteoporosis or bone fractures? Or on the other hand, you're not afraid of it like I'm not afraid of it because your family comes from strong bones. And last but not least, do you have a strategy, perhaps a daily strategy, to invest and maintain the strength of your bones? Again, more questions. If you're thinking I'm going to provide you more answers and I provided instead more questions, don't worry, the answers are coming. So the top thing to consider, first and foremost, why are your bones important? Well, it's a no-brainer. Not only do bones give your body its shape, they also give it the support it needs. And your bones are pretty much essential for moving, walking, standing, carrying anything from point A to point B, whether it's light or heavy. Your bones act as levers, allowing muscles to initiate and support any type of movement. Bones are the support, the strength. Your muscles will do nothing without bones. Now think about how vital the bones of your skull, your vertebral column, your chest, and your pelvis are. These are very, very important bone structures protecting your most vital organs, your brain, your spine, your heart, and your lungs, and last but not least, your reproductive organs. Your bones also have a very valuable role in your metabolic support. They are a significant calcium and phosphorus reservoir, allowing a constant exchange between the available supply and the body's demands. And last but not least, as a reminder, your bones, some of your bones, contain your bone marrow, where the body will make the red blood cells that are needed to carry oxygen, and your immune system cells, without which you cannot live. So the bones are absolutely essential, not just for strength and power and movement, but in order to have a normal daily human life. If you have ever broken a bone and needed surgery or needed a cast or a brace, followed by prolonged immobilization, and then an even longer rehabilitation and physical therapy, you know exactly what I'm talking about. I've never broken a bone, but I had 7 knee surgeries, 5 on the left, 2 on the right. I know everything there is to know about being immobile, not being to work out, and then needing to hit the gym and the rehab real hard, and how difficult it is to build it all back up. If you have personally experienced the loss of function brought about by the temporary loss of bone strength, muscle strength, or joint strength, you know that you never want to experience that again. Now think about this for a second. We all drive cars or motorcycles or bicycles, depending on everybody's fancy. Some of us can experience accidents, which can result in broken bones, known as fractures. We all walk on a flat surface, always. Sometimes an incline, sometimes we go down a steep slope. We can lose our balance and experience a fall. It can unfortunately result in a fracture. We all have to periodically and randomly walk up and down steps. And either because most of the time, probably we don't pay attention, probably because we look at our phones, we trip and we fall. We have some pain, some swelling. We go to the doctor, we have an x-ray, we find out there's a small crack in one of the bones in our foot. Now you have to wear a boot until it heals. You can have an accident, unfortunately, at the gym, in a workout class, or something as simple as dropping a weight on your foot, getting your foot stuck in the pedal straps at the end of the cycling class and falling over while trying to get off the bicycle. I mean, I've seen a lot and heard a lot. Maybe you attempted a challenging yoga pose for the first time without any supervision. The list of possibilities on how we injure ourselves that could lead to a fracture is long. We are surrounded by many obstacles in our environment, wherever we go, whatever we do. Some of us are pretty accident prone, whether due to lack of focus and poor attention span, or poor balance issues due to medical conditions or muscle weakness. The danger of breaking a bone is real. And the weaker and more fragile your bone is at the time of injury, the stronger the chance it will break and you will have a fracture. Let's think about the statistics a little bit. The lifetime risk of breaking a bone is estimated to be 30 to 40%, much higher, over 50% as we cross into and beyond menopause as we age. Yes, I'm mainly talking about women at this point. We do want to take our bone health seriously. Maybe you don't invest in your 401k, or you don't have a retirement fund. Maybe you believe you will work as long as you can, and perhaps rely on Social Security when time comes for retirement. Here is the truth. No matter whichever approach you have, 401k, no 401k, lots of money for retirement or not, regardless, your bones will have to get you there. And even if you don't invest in your retirement financially, investing in your bone strength is something you need to consider. It will indeed require very little effort, and it could be free and simple to do. I will talk about it when I get to the treatment part. I just wanted to set the stage for it and to get your juices flowing. In case you didn't know, women are much more at risk for osteoporosis than men are. Why? Well, the answer is usually not that complicated. There are multiple reasons, but the biggest one is the fact that after menopause, women lose all estrogen or almost all estrogen, but men continue to make testosterone most of their lives. This should immediately make you ask the next question. So, how important is estrogen for my bone strength if I'm a woman? It is not just very important. Estrogen is vital for the strength of your bones. And this information is knowledge every woman and her loved ones, her husband, her brother, her uncle, her family should have. That estrogen, it's extremely vital for a woman's bones. Without estrogen, a woman's bones, unfortunately, can fall apart. Not to worry, I will discuss simple and easy things you can do daily to protect your bones from getting weaker and weaker, even if you don't decide to add estrogen to the treatment part. Things that you should do before you say yes to the modern biologic drugs like Prolia, Evenity, or the biphosphonates like Fosamax or Boniva. But in order to understand the benefits versus risks of possible treatments, you need to understand how bones work, what makes them stronger and what makes them weaker. Because when someone comes to you and says, well, I want to give you this medication, and this medication is going to have these possible side effects, but it will improve your bone density, you want to ask, well, wait a minute, what does it do to my bones? And does it just improve bone density, or does it actually improve bone strength? So when we talk about what makes our bones stronger or weaker, obviously, I just told you, hormones play a huge role. The anabolic hormones that we have in our bodies will promote bone formation and repair and will restore normal bone, whereas catabolic hormones weaken and accelerate bone remodeling. And before I get into the whole nitty-gritty of hormones and why hormones are important and which hormones are important, let's talk a little bit about the fact, just for 1 minute, that your bone strength is the result of the constant process of bone remodeling, since I mentioned bone remodeling. What does that mean? That means old bone is removed and new bone is built to replace the old bone. The bone remodeling helps repair the very small day-to-day micro damage that happens to the bone structure due to the daily activities and our metabolic processes. And indeed, our bones, because they constantly remodel, are living tissue. And there are very special cells that are responsible for all these processes inside the bone. And it is important to know their name, because when I will discuss the treatment options available for osteoporosis, you need to know how each therapy influences the bones and the mechanism of action for each medication or hormone or intervention. So when we say osteoblasts, osteoclasts, you probably need to know what they do. So a few names that I will use throughout the discussion about bone strength and remodeling are osteoblasts, which are the cells who build bone. Osteoclasts are the cells who destroy bone. And then osteocytes are the mature bone cells embedded in the bone structure that are there all the time. Now, the osteoblasts that make bone and osteoclasts that remove and destroy bone have to be in balance. The activity of these cells has to be balanced. And this balance between the osteoblast and the osteoclast are highly influenced by the anabolic and the catabolic hormones. So, which are the hormones that build bone, also known as anabolic hormones, because they stimulate the bone building capacity. They repair and restore damaged bone. They promote formation of new bone. They help shape the bone structure. They do all that by stimulating the osteoblasts. And you need to know this because the medications that I'm going to talk about later in one of the future chapters, we don't have time for that today, are not going to necessarily stimulate your osteoblasts the way your hormones do. They will actually work on something different, and that's important, okay? So coming back to the anabolic hormones, your body has three very important anabolic hormones. Number one, again, this is a woman's body. Number one, growth hormone and insulin growth factor 1, also known as IGF-1. Both of these increase the number of osteoblasts and make them work better, which obviously will support the formation of new bone, especially when a young human body is growing from a child to a teenager and then an adult. Hence, the growth hormone. They also support and promote new bone formation in response to mechanical loading. And I'll talk more about mechanical loading, which in less fancy words really just means weight bearing, when I discuss treatment strategies for osteoporosis. But remember that the growth hormone is not just for growth. It's not just to make you grow from a child to a teenager to an adult. It is important for adults, and it's one of the most powerful anabolic hormones supporting bone strength, muscle strength, and keeps you fit and supports a healthy metabolic rate. Now, number two, anabolic hormone, guess what? You know it, it's coming, it's estrogen. It stimulates bone formation, is crucial to maintaining bone density. This is the go-to mother hormone for your bones. Normal levels of estrogen will help preserve the strength of the cortical bone, which makes up about 80% of the human skeleton and forms the hard outer shell for all the bones, especially the long bones like the femur and the humerus. The remainder of the 20% of the skeleton is made up of the trabecular bone, which is mainly found at the end of the long bones and in the bones of the spine, the pelvis, and the wrists. And the trabecular bone has a porous structure, almost like a sponge, and is supported by these little branching, needle-like appearance structures, which are called trabeculae. As it turns out, estrogen maintains both the cortical bone and the trabecular structure. Without estrogen, a woman is extremely prone to lose bone strength. I said extremely prone, very high risk, doesn't necessarily mean that all women are getting osteoporosis in menopause. And when I say women are very prone to lose bone after menopause, it's not just menopause. Any condition that causes estrogen deficiency, like certain birth control methods, are going to lead to bone loss. More importantly, when they're happening at a young age, the woman is not going to be able to achieve an optimal peak bone mass if she's estrogen deficient between the ages of 15 and 25, which can unfortunately have catastrophic consequences for when she enters menopause. And that's maybe why some women have worse outcomes and less bone strength when they enter menopause and more prone to menopause because they never had a chance to achieve their peak bone mass. Number three anabolic hormone is testosterone. It's influencing bone strength in women very, very powerfully. And in case you didn't know, yes, your bones have androgen receptors, and testosterone is responsible to stimulate new bone formation and increases bone mineral density, overall improving the structural integrity of your bones. When a woman in menopause suffers from low estrogen, but she has good testosterone levels, interestingly enough, she can actually convert some of her testosterone into forms of estrogen, which can actually prevent the increased activity of osteoclasts, the bone-destroying cells I mentioned earlier. So testosterone is very helpful to maintaining bone strength. So those are the three main anabolic hormones that support and maintain your bone strength. Growth hormone, estrogen, testosterone. We need their anabolic drive in order to have good, strong bones and good, strong muscles. Now, think about this for a second. What happens at menopause for women? Well, the perfect trifecta of loss. You lose your estrogen, you probably lost testosterone a decade earlier, and you will slowly lose the remaining 50% of your growth hormone over the next few decades. So we lose our anabolic hormones. And many people wonder, why do I have weak bones? That's probably why. A few words on catabolic hormones, the ones that actually increase the risk of your bones breaking and literally weaken your bones. There are three major catabolic hormones. They are cortisol, thyroid, and parathyroid. Let's talk about cortisol for a few seconds. This is your stress hormone, and unfortunately, cortisol will directly interfere and damage your bone strength and compromise the health of your bones through a variety of mechanisms. The most important is the influence cortisol has on increasing the lifespan of osteoclasts, the cells that break down your bone, while shortening the lifespan of osteoblasts, the cells that you need to build new bone. So when you have too much cortisol, like in chronic stress conditions or certain medical conditions like Cushing syndrome, or women who have to use long-term steroids for either transplant management or most commonly for autoimmune conditions, the old bone removal is accelerated much faster than the new bone formation can keep up with it. On top of all that, the excess cortisol from, again, either iatrogenically administered or naturally from excessive stress or a medical condition, can lead to low calcium. And without enough calcium, the body will start demanding to get calcium from the huge reservoir of calcium that's easily accessible. That's your bone. And your bones will hence get weaker. Last but not least, cortisol can suppress very effectively the natural production of estrogen. And that is why the menopausal stress is highly damaging and possibly particularly devastating for women in menopause and for postmenopausal women. And obviously, it's important to mention right about here that chronic stress will unfortunately drain your body of very important nutrients that are actually necessary to build new bone. Magnesium, vitamin C, B vitamins is just consuming them. So they're not going to go to your bones to help the bone repair, which will totally slow down any possibility of tissue repair because these vitamins are going somewhere else to fuel the demand for cortisol and the consequences of stress. So stress is bad for your bones. Please remember that. Number 2, catabolic hormone is thyroid. This is an absolutely necessary hormone. You cannot live a normal life without thyroid. And normal thyroid levels are very important for healthy bone development. Now, unfortunately, too much thyroid will speed up the bone turnover, leading to a loss of bone strength and density because same thing as the cortisol, the formation of new bone will not be able to keep up with the increased rate of destruction. Many women are being treated for hypothyroidism. Iatrogenic-induced hyperthyroidism, when the doctor gives you too much medication or you feel that the higher dose is better for you because it gives you better energy and it makes you melt the fat, consider that that could actually be a risk factor for osteoporosis if going for a long time. And number 3, parathyroid hormone. This is the last catabolic hormone I'm going to mention. Having a normal parathyroid hormone is very important because it regulates calcium level in your blood and acts as a calcium regulator for your bones, which means that when your blood levels of calcium are low, the parathyroid hormone will tell the bones to release more calcium into the bloodstream because I don't know if you knew this, but calcium is essential to keep nerve, muscles, the heart all functioning correctly and optimally. So if by any chance there is too much parathyroid hormone from either an overactivity of your parathyroid gland or from a tumor, the parathyroid hormone excess will leach too much calcium from the body's skeleton, weakening the bones and increasing the risk of osteoporosis. So having high parathyroid hormone, it's one of the key lab tests any doctor should do and order when osteoporosis is diagnosed. We need to rule that out. And it's interesting to know that chronically elevated parathyroid hormone stimulates conditions that lead to the development of osteoporosis and weakening of the bones. But interestingly enough, intermittently elevated parathyroid hormones, like when the parathyroid hormone is released in surges, that actually stimulates the osteoblast bone-forming cells. and it can help build bone mass and strengthen the architecture of the bone. So that's a very interesting paradox. And occasionally doctors will use this tool as a therapy for severe osteoporosis. Now, this little conversation here about anabolic and catabolic hormones is simply to give you some insider knowledge into how important hormone balance is for the strength of your bones and why, unfortunately, optimal balance matters, and it matters drastically. Your bone strength will depend on the right mix and timing of anabolic versus catabolic influences and signals on your bones. Now, obviously, women are more at risk for osteoporosis than men, not just because they lose estrogen at menopause and because men continue to make testosterone for the rest of their lives, but due to other very important factors you probably should consider. I will end this podcast episode with this topic, and I will continue the conversation of osteoporosis next week. But before I go, I want to review these factors that make women more at risk for osteoporosis. Because if you are a woman listening to this podcast, you need to pay attention and care about your bones. Women are more prone to osteoporosis because they generally reach a lower peak bone mass as young adults compared to men, which unfortunately means they have much less bone to lose as they age compared to men once they hit 50. Remember I told you about the peak bone mass? Your body continues to grow, develop, and strengthen until you reach peak bone mass sometime around 25. And if you don't reach peak bone mass, because, and this is a warning for young women who are considering a birth control method that can impact their bones. This is a warning for women who have been on birth control hormone therapies since they were at a very young age. Because these birth control methods that we offer young women will have an impact on their bones. And I'm not just talking about Depo-Provera. I'm also talking about the regular birth control pill. There are quite a few studies showing that teenagers who use birth control pills for 2 years or more unfortunately have a much lower bone mass than expected. So if you're a woman with a young daughter, granddaughter, maybe think twice. She needs to be on long-term oral birth control therapy. And if you are a woman that has used the birth control method impacting her bone strength when younger, it means you might be at risk for osteoporosis later in life because you were held back from achieving your peak bone mass. So if you're one of these women that falls into this category, please consider doing testing early to screen for osteoporosis. Don't wait till you're 60, as the current guidelines recommend. Another factor that particularly impacts women is the fact that on an average, women are smaller. So they have smaller and thinner bones in certain parts of their skeleton, which makes these bones much more vulnerable to osteoporosis and frequently fractured in case of a fall or a trauma. And another factor to consider that makes women more prone to osteoporosis is pregnancy and lactation. Consider the fact that many women, especially some who have repetitive pregnancies and extended breastfeeding periods, will have temporarily increased calcium demands. And unfortunately, that can contribute to bone loss if there isn't adequate supplementation or sufficient nutrition. So if a woman has 5 children in the time span of 10 to 12 to 15 years, and she spends a lot of time being pregnant and a lot of time breastfeeding and doesn't supplement the right minerals, then yes, she will be at risk for osteoporosis later in life. Now, last but not least, women are much more likely to suffer from certain medical conditions, which requires them to use medications that impact bone density negatively. One example, thyroid disorders. Very frequent in women, and many women can find themselves in situations where they get too much thyroid medication, which is why their therapy needs to be closely monitored. I like checking my thyroid patients every 4 to 6 months. I don't give them a prescription and say, come back in a year. It is not wise to walk away with a 1-year prescription of thyroid medication and believe you are safe. Let me give you some examples on situations that could happen between you getting a prescription and seeing the doctor again a year later while being on the same unchanged thyroid medication. You work out significantly less for whatever reason. You have to become more sedentary. Or suddenly you are ill and your appetite and nutritional intake has significantly lowered. Or you have a combination of these two factors. This automatically means that your thyroid dosage will need to change. Having too much thyroid for your needs can be really well tolerated. And without too many signs and symptoms, it actually can help you feel better when you don't feel good. But it could have unfortunate consequences for your bone health. So if you're a woman taking thyroid medication, remember, it should be closely monitored every 4 to 6 months, depending on your risk factors. And another thing is women suffer from a variety of autoimmune conditions, requiring the unfortunate use of intermittent, sometimes long-term steroids, which, as I said before, increase the risk of osteoporosis. As a conclusion, I hope you understood clearly from today's episode how important your bones are and why we need to maintain our bones as strong as possible as we age. Because guess what? No one is more prone to falls and accidents than the elderly. So as we age, we're going to be more prone to fall. If our bones are weaker, we're going to fracture them very easily. We will all get there one day. I hope you heard the truth about your bones and hormones and how valuable estrogen, testosterone, and growth hormone are to your bone health. Ignoring other medical conditions like thyroid problems, autoimmune disorders, chronic stress, poor nutrition caused by chronic indigestion, which 2/3 of Americans have, is a perfect recipe for disaster as we age. And now with the GLP-1s that everybody's on to lose weight, that's compounding the risk even more. So stay strong, stay healthy, and let's care more about bone strength. Let's not wait until a fracture happens in order to care about our bones. Being proactive is key when it comes to maintaining or building good bone strength. And I will continue the discussion on this topic next week. Thank you for the time and energy you spent listening to my podcast. If this episode or another have caught your attention and delivered valuable information you have not heard anywhere else, and if you feel I have succeeded in my mission to provide the how to stay healthy and age beautifully, please leave me a review. And any suggestion to improve the podcast will help make it better for you and for others. You can send my staff a message directly by sending an email to receptionist@herahealthcare.info.